And to our first story, from tomorrow, mothers can take their babies for shots of measles, BCG and oral polio vaccines now available in the country. For months, babies were turned away because of a nationwide shortage and the uncertainty brought on by the financial difficulties faced by the Ministry of Health in purchasing of the drugs. But now, the Ghana Health Service has begun supplying various hospitals with the first consignment, which came in Saturday in anticipation of a mass vaccination from Monday. Dr. Patrick Kumar-Boaje is Director General of the Ghana Health Service.
The first batch of the vaccines just arrived, and we have doses in BCG, oral polio vaccine, and then the measles vaccine. They just arrived with the accessories, the syringes, safety boxes, they've all just arrived. And so immediately they are being dispatched to the regions, and then latest by Monday, vaccination will start across the country. We want to use this opportunity to assure all mothers that there will be enough vaccines for everybody. There's no rush. They should come and get the vaccine as they are due. So this is the 3 out of the 10 vaccines. We normally have 10 vaccines that are used for 13 diseases across Ghana. 3 of them were in short supply. That is the OPV, BCG, and the measles rubella vaccine. We have received quantities of the 3 to complement what we are doing. And this is the first batch that arrived. We are hoping that the rest will come in very soon. We are moving all the supplies to the regions and the facilities, and so by Monday morning, there will be vaccines available for those who need it. The doses that are available is enough for at least a minimum of 6 weeks across the country, while the others are brought in. So we have enough doses to cover our need for the next 6 weeks. We are moving to the cold room, and the regional cold vans are waiting to pick them up and quickly send them to the regions and to the facilities, so that by Monday, as I said, we would start vaccinating all. These new vaccines are just going to help us do a catch-up to make sure that by the end of the year, all children who are supposed to be vaccinated are vaccinated. And so, even though there's a delay for vaccination, the most important thing is that you will take them as and when they come. If you can't take them before the due date for the next booster, but the days after still doesn't really affect the immunity that's supposed to provide for you. And we also have heard rumors of people parading around with vaccines. Vaccines are not sold in the shops. They are not sold on the tabletop. So they have to be careful that people are not bringing in vaccines that are not of good quality. We have vaccines across the country now, and everybody should relax. Go to their point of care, and they will be all vaccinated.
And you heard Director General of the Ghana Health Service, Dr. Patrick Kumar-Boaje. We've also been speaking to Professor Hassan Abdul Mumin, who is Northern Regional Chairman of the Ghana Pediatric Society and also a consulting pediatrician who is excited about the arrivals of the vaccines.
I mean, for us at the Pediatric Society of Ghana, it's a huge relief, and I think it will be a huge relief for all Ghanaian families and parents and all other stakeholders who are very much interested in the well-being of the Ghanaian child.
Let's stay a while longer on health issues now. Kidney care specialists are advocating for the formulation of a policy framework on non-communicable diseases with a focus on kidney in Ghana. The head of the Internal Medicine Department of the Whole Teaching Hospital, Professor Wuku Asantiyao, wants the framework to ensure proper access to healthcare for chronic patients and a well-thought emergency preparedness plan. He was speaking at a stakeholder engagement on kidney disease in the Volta Regional Capital, Ho.
Kidneys are 2 bean-shaped organs that filter the blood, removing waste and extra water to make urine. diabetes, high blood pressure, heart disease, smoking, family history of kidney disease, old age, frequent use of some medications, among others, may lead to kidney disease. When this happens, the kidney fails, leading to advanced chronic kidney disease, which can cause dangerous levels of fluid and wastes to build up in the body. Though it is reported that 1 in 10 open patient department cases are kidney-related, treatment in Ghana is scarce and expensive. Given this, the Ho Chi Minh Hospital organized a stakeholder workshop to digest and adopt the best approach to dealing with kidney disease. Professor Ewuku Asante is the head of the internal medicine department of the Ho Chi Minh Hospital.
There's a skewed distribution of dialysis services in Ghana. And like I said, Volta and OT, you can only get it in Volta. So you can imagine somebody from Keta has to come all the way here and go back. No. So we need to look at making it more accessible. Out-of-pocket payment for dialysis in Ghana, quite a big one. You have cost up to 500, and maybe some place 600 per session. And I've told you that we need 3 sessions a week, ideally. So let's use the 500 to calculate. So 1,005 a week times 4, 6,000. This is just for dialysis. Don't forget there's transportation to the place. There's erythropoietin, which is also not paid by the insurance that you have to buy. So if we want to really look at it very well, you are paying about 8,000.
He therefore suggested the introduction of a policy framework to ensure chronic patients receive the best of care.
Including chronic kidney disease. So it has to be at the policy level and disseminated downwards to all of us. Healthcare services to provide equitable and proper access to care for chronic patients in times of emergency. How do we do that? We have to think about it to be able to get it done. Government should include emergency preparedness plans in the management and detection of NCDs and favor the prevention of these conditions. And this is my favorite part, the last one.
The Ho Chi Minh Hospital Director of Health Services, Dr. Lord Mensah, assured of its outfit's preparedness to deliver the best of care to chronic patients.
This occasion is aimed at making the populace aware that you don't have to stay at one place when you know you have a problem with your health. We are ready to support.
There are a lot of young men and women still drinking without thinking of what kidney diseases are. Stakeholders here, it is for us to educate our communities when we go back.
Fred Kwame Asari, Joy News, Ho.
Now, the Deputy Lieutenant to His Majesty King Charles III, Names Obunge, is urging Commonwealth nations in Africa to invest in the youth as a sign of their commitment to peace. The move, he said, will stop or help contain and prevent various insurgencies occurring in some countries across the continent. Names made the call in a service organized at the Rich Church, Accra, on Sunday, ahead of commemoration of the Commonwealth Day across all member states on Monday. My colleague James Aveji has come through with this report.
Starting in 1977, the Commonwealth Day is observed amongst all 56 member states every second Monday of March to commemorate the need for equity and peaceful coexistence. Ahead of a flag-raising event on Monday, the Commonwealth Mission in Ghana organized a memorial service at the Reed Church in Accra to deliberate over this year's theme, Forging a Sustainable and Peaceful Common Future. In a speech, Deputy Lieutenant to His Majesty King Charles III, Lieutenant Names Obunge, underscored the need for member states to uphold the core values of the Commonwealth Charter.
And we have a responsibility to hold these core values, which I want to remind us of. And I took notes of them just to ensure I did not forget one of them. Democracy, human rights, international peace, tolerance, respect and understanding, freedom of expression, separation of powers, rule of law, good governance, sustainable development, protecting the environment, access to health, education, food and shelter, gender equality, importance of young people, recognition of the needs of the small states and recognitions of the needs of vulnerable states, and the last thing, the role of civil society. when we raise the flag all across every city in the United Kingdom, and we raise the flag here in this nation, and we raise the flag in other 56 member states, we pray for the peace across all our nations, because as one family, we owe it to ourselves to ensure the other is safe.
Lieutenant Neems also urged African leaders to encourage the youth to take up power in the bid to end the insurgencies across the continent.
Why is it that increasingly we only have leaders who are old in Africa? And so what happens is we've not empowered our young people to think that they can be leaders of nations, leaders of states, leaders of regions. So we need to reinvest in them and let the old folks start learning how to hand the baton over and empower the young people to be part of the conversation. But what should not happen is that young people run off without understanding the legacy of the old. There has to be a partnership between the young and the old, and being able to see that the future is a combination of the old and the new coming together to build a nation state all across the world.
Head of Mission of the Commonwealth Enterprise and Investment Council, John Appiah, said the council is working on facilitating smoother trade of common goods between 21 African Commonwealth states and the UK. He spoke to Joy News.
We're trying to match businesses together with strategic partners to see how they can grow their businesses. Businesses in Ghana and other African countries. You have Ghana, you have Kenya, you have Rwanda, fresh flowers. You see fresh flowers in the UK, 90% are from Rwanda or Kenya. You see coffee from Rwanda. You see cocoa from Ghana. You know, we're creating markets for mango, for pineapples in supermarkets all in the UK and other Commonwealth countries, and in our little way at the micro level that opens the door and promotes economic prosperity.
John Appiah also noted that African states must encourage direct transit of goods and services amongst them to maximize the benefits of the African continental free trade area.
Let's say I'm even traveling to Sierra Leone or I'm traveling to Gambia. You'd be surprised sometimes I have to go all the way east or even go out of the country to come back in. If a country like DRC, for instance, if you're in the northern part of DRC, to get to the capital Kinshasa, it's easier to cross the border to Uganda and then take a flight into Kinshasa. Africa is not connected. So when I even buy a plane fare within Africa, the taxes I pay is more than me flying to the UK. We have to find out how we connect ourselves through infrastructure, through railways, through roads, and connect ourselves. Excise duty, see how we can reduce it to make it cheaper for me to sell tomatoes to Gambia than for the tomatoes to be shipped from India to Gambia. That is the key.
The week-long activities to commemorate the Commonwealth Day continues on Monday with the flag-raising ceremony in solidarity for peace and development. James Kwesi Avaji's report, read to you.
Now, Deputy Minister for Sanitation and Water Resources and MP for Sisala East, Amidu Chinya Isahaku, has urged the people of Sisala to exercise restraint in their demands for their share of roads. The minister said in spite of the failure of successive governments to improve the state of roads in the area, residents must be measured in expressing their displeasure while demanding accountability. Joy News Upper West Regional Correspondent Rafiq Salam has more.
One major challenge faced by the Wollambale Polyclinic is the lack of an ambulance, which authorities say is impeding quality health care delivery. According to a physician assistant at the Polyclinic, Amos Apla, patients who are referred to seek further medical care at the Tumu Municipal and the Upper West Regional hospitals or outside the region are unable to do it on time due to lack of an ambulance. He cited an instance of a 3-month-old pregnant woman who was brought to the facility.
So how to refer her to why was a problem? We referred, but how to get the mean to send the police staff to why was a whole lot of problem. So we have to go around from up to down to beg for a mean. So it was a woman that actually helped us to get a mean, and then we fuel it and send our colleague to Bolga for a medical checkups.
All this will come to pass with the donation of an ambulance to the Polyclinic by Deputy Minister of Sanitation and Water Resources, Amidu Chinya Isahaku.
Wollambale is the second biggest health facility in the Sisala East, apart from the municipal hospital. And it's supposed to serve the whole catchment area from here to Bugubele to Jijien to Sentier to Bande to Tasso, Kulufu, Nabulo, Bewis Boy, Komo, Gosi. This catchment area, if we are able to equip this facility well, is going to serve this whole area, so that instead of going to the municipal hospital, anybody who has a problem, health problem within this area, or should come to the Walambele Polyclinic.
He commended the medical superintendent of the Walambele Polyclinic and his staff for their commitment to duty in providing quality and affordable health care to the people.
In a matter of 2 years, 80 operations. All these 80 people should have gone to Tumu or Wa. And you can imagine you go to a facility where your house is very far from, the discomfort, the inconvenience, and all that. But anybody around Walambele, if you are supposed to have an operation from Bugubele and you come to Walambele, it is more comfortable than moving from Bugubele to Tumu. If you are from Tasso, it's more convenient to come to Walambele than going to Tumu. If you are from Nabulo, it's more convenient to come to Walambele than going to Tumu. So you can see the kind of support he is giving to this area.
He disclosed plans of ongoing works on 22-bed capacity wards for 4 communities in the constituency.
I am constructing a 22-bed capacity ward in Bugubele. I'm doing same in Sakai. I am doing same in Nabugubele. I'm doing same in Mandono. 4 major health facilities being constructed by not the central government, by the MP. I have not seen any MP that has ever undertaken and constructed a 22-bed capacity ward in Sisala land. It has never happened. I have just donated an ambulance to Walambele Polyclinic. Can you remember any MP has donated an ambulance in the Sisala area? These are major strikes.
One major challenge, which is an affront to providing quality health care to the people of the Sisala enclave, is the deplorable nature of roads. The issue, for some time now, has brought lots of social tension in the area, resulting in holding of press conferences and demonstrations by the Sisala Youth Forum. Amidu Chinia considered that very little attention has been given to the Sisala enclave by successive governments, which has resulted in what he called accumulation of emotion and anger by the people on the government. He was however quick to add that the narrative has changed today with the coming into being of the MP administration.
There is a historical antecedent or historical problem that the Sisala people face. And so we don't have to be too emotional when it comes to our roads. For more than 50, 100 years, our roads have not been tackled. How many roads have been tied in the Sisala area? It's like we have not been part of Ghana for a very long time. But it appears that the emotion and anger is coming at this particular time on an accumulated problem. It is not a problem that started today. We have had ministers coming from the Sisala area, we have had MPs coming from the Sisala area, but it has remained a problem. But if you look at what is happening now under President Nana Akufo-Addo, you can see clearly that there is major work that is being done.
Medical Superintendent of the Walambele Polyclinic, Dr. Emmanuel Ogbami, thanked the Sisala East Legislature for the donation. Dr. Ogbami used the opportunity to appeal to the government, corporate organizations, and benevolent individuals to come to the aid of the Polyclinic to help solve some key challenges in order to improve healthcare delivery in the area.
A lack of infrastructure. As we can see, there has been no additional infrastructure to the old health center building. The maternity unit block project has been halted since 2020. We have about 3 prescribers with only 1 consulting room. The administrator and medical superintendent also have no office. Number 3, we have no official pickup vehicle, and so I have to move from Tumu to work in ovens and motorbikes sometimes getting to work very dirty.
Reporting for Joy News, Rafik Salam, Walembele.
And now to the University of Bochum, Germany, who is calling on government of Ghana to support recyclers of electronic waste in the country to help reduce the impact on the environment. Engineer Sami Severengis, the leader of a delegation of one of Ghana's pioneering electronic waste companies, Electro Recycling Ghana, believes a stronger collaboration between government and private companies in the sector will help solve the e-waste canker in the country.
The Electro Recycling Ghana is a private company committed to producing electronic gadgets from electronic waste. So far, the company has been manufacturing televisions, from discarded electronic materials. Nanaya Kunedu is the company's co-founder.
It's been a tough journey. We started the company 2019, I think March, and we rented this place. You know, Ghana here, when you rent a place, you need to pay a year, 2 years advance, and it's not a small money that we paid for this warehouse. So it took us 7 months before EPA gave us the permit to operate, but the rent was running. 3 months before 2019, or 2 months, where we are trying to have a shape to generate some funding, then COVID, I think 4 or 5 months later, COVID hit us. So again, we need to pay a year rent in advance without any revenue. We're ready to face the challenges, and I think the last 4 to 5 months, we have seen a very positive change. Also, the support that came from GIZ, I will introduce later, a very great support that helped us to generate another revenue for the company.
The company has had its works attracting foreign universities and organizations to study its model. One of such universities that has supported ERG since it began is Germany's Bochum University. Professor Engineer Semer Severinges is a professor at the university, and he says ERG has been impressive over the years. He wants government of Ghana to get interested in the work of electrorecycling Ghana.
I'm very impressed what I could see here, so I believe that ERG is doing a pioneer job here in Ghana. It's a very important thing to do the right things in the right way, so I take it very serious as a strong contribution for sustainable development of Ghana, for getting the problem of e-waste solved. Yeah, I think the government should support that kind of initiatives, so strong collaborations also for knowledge transfer with German companies, with German universities, from practitioner side, but also from German companies and universities. I believe that the Ghanaian government already knows that this is an important topic and that they will support your activities.
GIZ e-waste program, an influential player in the electronic waste space in Ghana, wants government to implement policy that will help the management of e-waste in Ghana. Cornelia Stolzenberg is head of programs for the organization.
I think that Ghana has a real good policy available already with the Act 917 and the LI 2250, as well as the technical guidelines for this sector. I think they are well equipped with it. The challenge is sometimes the enforcement. And there, of course, a lot of actors have to come together to do that. And it's not just that, let's say, the EPA has to do it or the MMDAs have to do it. So there has to be a clear system how to implement the legislation. But the legislation is very, very good.
The electrorecycling Ghana has been successful with its unique TV product, and is now completing a prototype electronic-powered bicycle to help reduce traffic in town. For Joy News, Samuel Kojo-Brace, Oyarifa.
You're still watching Joy Prime. We'll be right back after these messages. And that's all for Joy News Prime. I'm Maame Thompson. There's more news on myjoyonline.com. Up next is sports.